Well, hello, everybody. This is Dr. Greg Poland. I'm a professor of medicine and infectious diseases at the Mayo Clinic in Rochester, Minnesota, and director of the Mayo Vaccine Research Group. I'm joined today by my colleague, Dr. Drs Essien, who is an assistant professor of medicine at the University of Pittsburgh School of Medicine. This is the final installment of a six-part series of podcasts on the COVID-19 vaccine landscape. And today we're going to have a conversation on overcoming racial and ethnic disparities in healthcare access to the COVID-19 vaccine. So Dr. Essien, welcome.
Thanks so much for having me. I really appreciate it.
By way of introduction, in 2020, at the peak of the pandemic, it was evident that our Black and other minority populations had worse outcomes, not only in terms of mortality, but also morbidity. So when rolling out these new vaccines against COVID at the end of 2020, the issue of mistrust for the healthcare system was a lingering issue that still needed to be addressed. And so today, the focus of this podcast will be on these racial and ethnic disparities and healthcare access to the COVID-19 vaccine. Well, let's start, Dr. Essien, with the impact of COVID-19 on Black and minority populations and kind of help us put these disparities into context.
Sure. So unfortunately, we have been talking about these inequities in COVID-19 really since the start of the pandemic. I remember back in March of 2020, my biggest worry was whether or not I would be able to attend a conference out in May for my medical society. But very quickly, we realized that this was going to be a pandemic that was affecting the communities that I've been studying, researching, and working with over the last 8 years or so. And we saw these headlines coming out of New Orleans, St. Louis, New York City, and Chicago suggesting that Black individuals were being exposed, being infected at higher rates than their white counterparts. And we continue to kind of see this story play out. Latinx individuals in the Bronx, where I went to medical school, and out in San Francisco, were getting diagnosed at higher rates. We saw American indigenous communities also being infected at higher rates. And as we saw the infection numbers rise, we then started to see the mortality differences. And my colleagues and I published a paper showing that Black individuals were dying at about 2.5 times the rate of white individuals, with Hispanic and Latinx individuals dying nearly at 1.5 times the rate. And so we really, throughout this pandemic, have seen these disparities persist. Back in December of last year, the CDC put out another report showing the lag in infections continued between white and Hispanic individuals. And that's why, again, it's so important for us to think about what are the big drivers of these disparities as well.
Very good. We certainly have seen that these social determinants of health play out regardless of whether we're talking about influenza, vaccines, diabetes, any of those. So those are really important issues that you have raised. Well, as we move on here, in terms of the vaccine rollout specifically with COVID, why was there mistrust for the healthcare system in these communities of color?
Yeah, you mentioned the social determinants of health, and I, in my previous remarks, referred to a number of large cities here in the U.S., cities that in some ways continue to be experiencing the legacies of discrimination, racism, and segregation. And I think it's that legacy that drove us towards these issues around mistrust or distrust in the healthcare system. It's a legacy that includes a long history of experimentation among communities of color, Black communities in particular, but several other racial and ethnic minority communities. And we've seen this again play out not just in history, but on a day-to-day basis. Over the last 5 years or so, we've really seen the conversation move towards us thinking about maternal health disparities, for example. And so we see these stories of Black women showing up to the hospital to give birth on one day and dying just a few weeks later. And so these aren't just historical factors. We have to think about the current day. And it's all that history, all that present day environment that really plays out with the vaccine, where folks said, you're not treating us before, like you mentioned with influenza. Why all of a sudden is this such an important deal?
Yeah, excellent point. Well, as we think about this, what were some of the methods that you believe were helpful or that still need to be enhanced for gaining and improving trust?
Yeah, I think that's such an important question. And, one of the key strategies, and not just with COVID-19, as you mentioned, but with any strategy to improve trust in our healthcare system, is to be transparent, to be clear about what we're doing, why we're doing it, and what the benefits are. I think that has been a challenge all throughout this pandemic with a lot of disinformation, but transparency, I believe, needs to be key. When it comes to research, especially with this novel coronavirus and novel therapies and preventive measures like the vaccine, ensuring that communities are included. I think we saw a lot more attention towards including racial and ethnic minorities within the various vaccine trials. I've seen some of my colleagues put out on their various platforms that they were involved in these trials to help, again, engender some of that trust. And so I think that was key. And I think this idea of being open when things aren't going as well as planned, whether it's the Johnson & Johnson vaccine taking a step back when we started to see some of the challenges there, really, again, being open, clear, and transparent about the process, I think will be helpful for improving trust, not just in minority communities, but across the board.
Yeah, very good. What are the other issues of concern among minority populations when it comes to the COVID vaccine?
Yeah, so I think the same concerns that we've had in other conditions, other disasters play out here as well. And one big one, as relates to inequitable care, is access to healthcare. Whether it's the 40 plus million Americans who continue to be without health insurance or full health insurance coverage, and how that influences their access to care. Now, again, not just related to COVID, but one of the first things that we heard folks say was, ask your doctor about your vaccine. What should you do? Ask them how you can get one. But again, what about these individuals who don't have a doctor? And for those who do, what happens when the pharmacies in the community are the big source of the vaccine and you actually don't have one close enough to your neighborhood? It takes a number of buses, a number of trains to get there, and you're still fearful of getting out into the community because you don't know about these new variants, et cetera. And so, again, these aren't conversations that are specifically and necessarily unique to minority populations, but I think the structural and social determinants, unfortunately, are hitting these communities harder and have always done so.
It's a very fair point, and it strikes me too that we tend to talk about this as if it is a monolithic population structure, and it certainly isn't. Can you kind of help us think about that?
Yeah, I think that's critical. My parents are West African immigrants. A lot of our social community comes from that part of the world, and their experiences with mistrust or understanding of the healthcare system is not quite the same as those who are descendants of enslaved Black Americans. Experiences of non-Black communities, Hispanic and Latinx communities who may have challenges around language. And so what information is being provided around the vaccine, and other communities. We saw that there are certain Asian communities who also had a lag in vaccine uptake. And so this is not at all a monolithic issue. We have to pay attention to our communities and individual patients' specific needs. I love this question that one of our colleagues often ask, which is to say, what's your why? Why are you challenged? Why are you concerned? Why are you fearful about getting the vaccine? Because if we do treat this as a monolithic issue, we may never get at some of their concerns.
Yeah, totally agree. And that, as you point out, is really true no matter what population we're looking at. Well, in the context of speaking about this, maybe let's talk some about the current status of COVID-19 vaccine uptake in our racial and ethnic communities?
Yeah, so the CDC has, over the last few months, done a better job at being able to report the data around COVID-19 vaccination. And so we've seen that there's definitely been a trend towards the increase in individuals getting vaccinated. We know across the country, we're about at 68% or so of folks being vaccinated. Back in January and February, we really saw quite a disparity between racial and ethnic groups. And I think rather than just looking at raw numbers, really paying attention to the percentage of the population who is being vaccinated. And so as of just a couple of days ago, we see that Black Americans, about 9% of them have received their first dose, or at least one dose. Again, that's compared to them making up about 12.5% of the population. We see that about 15% of Hispanic individuals have received their first dose, while they make up 17% of the population. And we see that Asian individuals have received, about 6% of them have received their first dose, which is about consistent with their population. And so we're seeing us get closer to the appropriate number, at least a percentage of the population. But again, we still have ways to go in ensuring equitable access to it.
Yeah. Do you think the lack of information or concerns about eligibility a concern?
Yeah, so I think some of the challenges were at the beginning. First, where do we get our vaccine? Is it from the doctor's office? Is it from the pharmacy? This pharmacy says we have it, but this one says I need to have an insurance card when I get there. So there's just been a lot of confusion. And I think what's something as challenging as this, where again, when a person decides, hey, now I finally decided to go get it, we need to clear off every single challenge, every single path, every single barrier that might be in the way. So if a website all of a sudden isn't quite pulling up the right eligibility, then that could potentially completely lose our chance there. So I think that that's a big part of it. Again, I think there's still, unfortunately, a bit too much disinformation out there around what the vaccines do, around what they might cause. And I think that fear is real, and continuing to have trusted messengers out at the front of the conversation, I think will be critical.
What about some of the remaining tasks that need to be done to ensure equitable access to COVID-19 vaccines among our diverse communities?
Yeah, so one of the things that struck me the most back in October, probably of last year, when we were first starting to talk about the vaccine, was how folks said, just because I'm an African-American physician, for example, doesn't quite mean that my patients are going to listen to me about this. I'm still part of the system. I'm still part of the game. And so really, really leaning on members of the community to engage with the community that they serve, whether it's the small business owner who connects with the kids and the who are walking home from school because of the store that they have. We tend to think about religious leaders who I think still have important roles within certain communities. But again, I think it's really bringing it back to folks who are living in the day-to-day spaces that our patients are in, so that it's not just this top-down voice saying, you must be vaccinated, but it's saying, hey, this is what my experience was. These were the challenges, these were the opportunities, and this is just my 2 cents. I think you should be able to get out there and feel safe.
Yeah, one of the challenges we noticed, and I'm sure you've seen this too, is where there might be educational challenges or literacy challenges. We saw vaccine information statements and consent forms for the clinical trials were written at the high school or lower college level, which the average American is unable to read or to comprehend. So almost by default, we end up excluding or causing mistrust when we do things like that.
Yeah, oh, definitely. It's a big challenge. And again, like you mentioned earlier, not just in COVID, I think this is an opportunity for us to really reimagine what our health system can look like in its most equitable way. And I think it does have to start with conversations like this. What do the consent forms look like that we provide our patients?
I love how you said that. This is an opportunity to reimagine our healthcare system and reimagine it to be equitable for all Americans. Well, I really want to thank you, Dr. Essien, for taking time out of your busy schedule to be with us. This is our final podcast of the series on the evolving landscape of COVID-19 vaccines. We've looked at a lot of different aspects of COVID-19 vaccine rollout, including vaccine safety, variants of concern, communication around misinformation, barriers to the second dose, rural populations, and now today, with your help, ethnic and minority populations. This, of course, has been an unprecedented global healthcare crisis with unimaginable consequences, really, in terms of life and our healthcare systems. And disparities have been, I think, glaringly exposed and amplified, not only in the US, but even globally. And this has forced us, I think, to take a long overdue look at healthcare issues in a different way. And as you said, in terms of the phrase reimagining, I really think we should use these as opportunities that lead to improvements for the future. Well, fortunately, these vaccines were developed in record time. The rollout has been successful in certain states and certain areas. They hold great promise for us getting out of the pandemic, but no vaccine is worth anything until it's in the arm of the right person at the right time to protect them. So, Dr. Essien, I want to thank you again. Anything else you'd like to say before we sign off?
No, I think that was a perfect end. I really appreciate the opportunity to share on this important topic. Like you mentioned, I think we're moving in the right direction, but we have to not just keep COVID-19 vaccine blinders on and really think about equity throughout the whole health system.
Well said. Thank you.